Hi, I'm Dr. Felice Gersh. Today, I'm going to talk about a topic I really haven't touched on enough. It's endometriosis. Endometriosis is a very common medical condition exclusively experienced by women. It's actually a reproductive age problem, and 10 to 15% of all women in the reproductive years do actually suffer with endometriosis. Generally speaking, prior to puberty and after menopause, it is not really a problem. Well, first, just a word or two about what is endometriosis. So endometriosis is a condition in which the uterine lining, called the endometrium, grows outside of the uterine cavity where it does not belong. In most cases, what happens is the uterine lining during the menstrual bleeding, during the phase of bleeding called shedding phase, actually goes back out the tubes into the pelvis. We call that retrograde menstruation. And this backflow includes blood and living and dead cells of the uterine lining, the endometrium. These cells should be dissolved and gobbled up by our immune cells. Unfortunately, in women with endometriosis, this does not happen efficiently, and these cells actually attach and grow onto surfaces, predominantly in the pelvis. So they can grow on the peritoneal surfaces, the smooth lining, interior cover of the pelvis and the abdominal cavity, which covers all internal organs and the pelvic wall itself on the inside. So you get peritoneal implants. As well, they can implant on fallopian tubes, on the bladder, and they can go on the intestinal tract and on the ovaries. And instead of dissolving, as I said, it grows and it causes very severe symptoms in many women. Yet, interestingly enough, some women experience no symptoms. The symptoms can include predominantly terrible pain, often dysmenorrhea, menstrual cramping pain, but sometimes there are pains in between cycles, pain with intercourse, where it feels like a deep, penetrating kind of a pain. Women often have pain with urination, with defecation. They will often have symptoms of irritable bowel syndrome. It's also accompanied often by emotional problems, as you can well imagine, because pain begets depression and mood problems, and vice versa. So it's a complex problem. And why does it happen? Well, we don't know for sure, but it seems to be somewhat genetically a tendency. And when women are exposed in utero or very early stages of their life to endocrine disruptors, the ones that have been most studied are pesticides like dioxins. And exposure to these pesticides during the developmental phases of the endocrine system causes an alteration in the progesterone function. So the progesterone receptors are not working properly. Well, it turns out that nature, when everything is right, takes care of this retrograde menstruation. This dead and dying tissue, this inflamed stuff that's coming out the ends of the tube into the pelvic cavity without proper regulation creates a tremendous inflammatory response because our immune system is activated by two things: pathogens like bacteria and viruses and fungi and such, and damaged tissue. We call them the PAMPs and the DAMPs. So this would be damaged tissue. The immune system would think this is damaged stuff coming out into the pelvis, and an inflammatory response would be activated. Well, in women who don't have endometriosis, the reason that this doesn't happen and you don't get this out of control inflammation is that the progesterone that's high during the second half of the menstrual cycle, the luteal phase, what it does is it programs through the endocannabinoid system receptors on the immune cells to slow down their immune response, to sort of deactivate them to a certain degree so that they're calm and they do what they're supposed to do by just gobbling up and dissolving those cells that are coming out the tube without creating an over-the-top inflammatory response. And also, when this happens and you don't have proper regulation of the immune cells, they not only create this uncontrolled inflammatory response, but they also do not properly respond to destroy and gobble up these cells. And when you have a lot of inflammation, it upregulates an enzyme called aromatase, which causes the production locally of estrogen. So when you have inflammation, aromatase is activated and estrogen is produced in the pelvis and in many other organs. That's how it works. Well, in the pelvis now, you have this explosion of inflammation, you have this explosion of endometriosis developing, and estrogen is being produced. So you have an explosion of estrogen being produced. Now, estrogen is the hormone of healing and nurturing, but it doesn't know that endometriosis is something abnormal. It thinks it's damaged tissue. So instead of destroying it, it nurtures it. It creates new blood vessels to feed it. It actually creates a home. It actually facilitates these cells implanting in these peritoneal surfaces and on the surface of these pelvic and abdominal organs. It's a mess. So what is the conventional approach? The conventional approach is shut down the hormone system. So if you get rid of ovarian function, well, you're not going to have periods. You're not going to have the production of progesterone. You're not going to have that problem if you don't have normal menstrual cycles. In addition, there's a new approach to block the enzyme aromatase so that you can't make local estrogen in the pelvis. Unfortunately, you can't specify where you're going to make it or not. So you're blocking the production of estrogen everywhere. And when you block the ovarian function, you're not just shutting down endometriosis to some degree, you're shutting down estrogen and progesterone that's really essential for the whole body. So I'm going to talk more about the conventional approach another day, but just understand that the conventional approach with pharmaceuticals is to block ovarian function using drugs that block ovarian production of the hormones estrogen and progesterone, or birth control pills which shut down the normal cycling. By the way, birth control pills sometimes ease pain, but they don't actually change the ultimate course of the endometriosis. And many of the drugs that are actually out there, they're just able to be used short term because shutting down hormones in a young reproductive age woman has many, many serious potential repercussions on the cardiovascular system, on bones, on all tissues in the body, including the brain. So what can we do besides surgery, which is another conventional approach, which is cutting out as much endometriosis as possible, and in the extreme cases, cutting out the organs, the uterus, the tubes, and the ovaries. So what can we do from an integrative approach? Well, now that we're going to talk about it, I think you're going to want to try these things if you have endometriosis. And what are our goals when we actually use the integrative approach? We want to reduce pain. We want to reduce the progression. We want to improve fertility, because I didn't mention that, not surprisingly, endometriosis is a big cause of infertility in women. And we want to maintain the organs in the body because these organs have tremendous use. We don't want to have to take out these organs if we don't have to. So let's talk about the 5 incredibly effective, not curative, but effective ways to approach endometriosis from an integrative approach. Well, the first is diet. I mentioned inflammation. Inflammation upregulates aromatase, the enzyme that produces the estrogen. Estrogen is not causing endometriosis, but it facilitates it because it's misguided. It's actually causing more problems by nurturing the endometriosis, because endometriosis is not a natural event, because pesticides are not natural to be in our bodies, and that's underlying the whole situation of causing endometriosis. So an anti-inflammatory diet that includes lots of plants, antioxidants, polyphenols, has been shown to reduce endometriosis. Isn't that amazing? So a plant-based diet filled with fiber and antioxidants, lots of fruits and vegetables, whole grains, nuts and seeds is amazing. Now, included in these foods are phytoestrogens. Many foods in the body are phytoestrogens. They contain natural polyphenols which act on estrogen receptors. And it turns out many of these act on the beta receptor, which actually calms down the immune cells. That's what happens in pregnancy. Pregnancy has a lot of estriol, which activates the beta receptor, which calms down the innate immune cells, the ones that are like the attack animals. We're calming them down when we include all of these polyphenols that have estrogen-like effects. So that would include organic whole soy products, flax seeds, some of the whole grains like oats and buckwheat, nuts and seeds like walnuts and pistachios and almonds, and pomegranates. Apples, by the way, these actually include these wonderful polyphenols. And then, in addition to the diet, there are certain supplements and herbals that can be quite effective. I'm just going to list them, and we can go over them in more detail another time. So, some of the herbals that have been shown to be effective are ashwagandha and peppermint, curcumin, pine bark, also known as pycnogenol, chamomile, chaste tree, EGCG from green tea, dim, which comes from cruciferous vegetables like broccoli. Omega-3, which is not an herb, is very anti-inflammatory. And there are vitamins and minerals that can also act as antioxidants, like in terms of minerals like magnesium, selenium, and in terms of vitamins like vitamin E and vitamin C and vitamin D. All of these are part of our toolbox in integrative medicine to help our women patients who are suffering from endometriosis. Now, what else? Well, I use a lot of suppositories that are made from hemp that include CBD and other cannabinoids. Now, no THC. This isn't marijuana-based. There's no mind-altering effect. But it turns out that, as I mentioned just briefly in passing, that the progesterone works to calm the immune cells so they don't go over the top in crazy inflammation response through the endocannabinoid receptors on the immune cells. Well, you can bypass the progesterone, go straight to those immune cells by using the endocannabinoids. But we don't have endocannabinoids, but we have a great substitute. We have cannabis products from hemp that includes the CBD, and I call them and friends for the entourage effect. So you can use directly into the pelvis with suppositories. You can use these wonderful hemp-based CBD suppositories. You can also use it orally, which I use, and sublingually. I can use gel caps and sublingual hemp products with excellent results. Additionally, many times a lot of the pain that's involved with endometriosis involves spasm and fibrosis of the musculature and the fascia of the pelvis. So pelvic floor physical therapy is a wonderful way to help control the pain. So pelvic floor physical therapy, where they massage out and get rid of the fibrotic areas like the knots in the fascia in the pelvic floor, is a mainstay of an integrative approach to treating and maintaining a good quality of life in women with endometriosis. And mind-body medicine. I love guided imagery. I love utilizing meditation. You can also do progressive relaxation. You can do tapping. All of the different mind-body practices can be amazingly beneficial because the mind controls the immune system, and you can reduce inflammation. You can control the autonomic nervous system, which is very involved in endometriosis response, through these various mind-body techniques. Don't forget acupuncture. Acupuncture has been shown to also be, it's really kind of a mind-body practice, and it's very beneficial for women. So women with endometriosis have all of the conventional therapeutic approaches, which basically, as I said, involve shutting down hormone production, surgically removing endometriosis, sometimes surgically removing the organs themselves, pain, of course, is a big problem. Many women became addicted to narcotics. We don't want to use narcotics in women with endometriosis, because addiction is really a threat and you're not addressing the problem. So I just wanted to mention the opioids, because opioids really have no place in the treatment chronically of endometriosis. And we now know when you use opioids like codeine products, you actually lower the threshold to feeling pain. So in other words, it takes less pain stimulus to actually develop a big pain response when you chronically use opioids. So please, that is not to be part of the therapeutic toolbox. So diet, an anti-inflammatory diet, targeted supplements, herbals, antioxidants, vitamins, minerals are amazing. Utilizing hemp-based products orally and vaginal suppositories. Pelvic floor physical therapy, amazing. And the mind-body tools, meditation, guided imagery, progressive relaxation, tapping, and acupuncture are wonderful tools that every woman with endometriosis should try to have a better quality life. Thanks for joining me today. See you soon.